In the simplest terms, medication reconciliation is the matching up of the medications that a patient is taking at home or in one particular setting, and then whatever medications may the patient receive in a new setting. So, it applies to patients coming in the hospital from home. It would apply to patients coming to the hospital from a nursing home. It applies to patients in the hospital going from one setting in the hospital to another setting in the hospital. As the patient's milieu changes, the medications may change, and you have to correlate the new medications with the old medications to make certain that the patient's getting the right medications, has no history of side effects, no history of bad reaction to a medication or allergies. Patients should have a record somewhere in their person or at home of the medications they're taking. Particularly true of older patients who, the older you get, it seems the more medications you end up taking. And you may not be able to remember all the medications, all the names, and all the dosages. So you should have something written down. Ideally, each patient has a list of medications that have been given to them by their primary care physician. That's who prescribes the majority of medications, are the primary care physicians, and a list should be in each patient's hands. Electronically, there are some means to do that. For example, I have a list of medications on my iPhone, and there are programs. The new Apple app, not to put in a plug for Apple, but the new iPhone app, I think it's called iHealth, has a section where you list your medications. Ideally, the list should be moved from the patient or the patient's family to the ER, and it would end up probably in the nurse taking care of the patient's hands, who would then transmit the list, share the list with the physician taking care of the patient. It's also important for a physician in the ER, for example, who may not know the patient, may not understand that the patient's on a given medication, which has a tendency to slow your heart rate down, and wonder why the patient's bleeding or had some trauma and doesn't have a fast heart rate. The list of medications is very important as new management of a patient begins. So the nurse and the physician would understand what medications the patient was on. The truth is, it's been looked at in many, many different studies, and the best guesstimate is that roughly 30% of patients arriving in the ER based on medications they've taken at home and are taking at home, 30% of the time, if that list isn't conveyed properly, there's a chance for a potentially harmful side effect or episode to occur. One of the major pushes, if you will, in today's healthcare delivery is to make the patient more responsible for their own care. Not that they can write their own prescriptions, not that they should do any of that, but they should know what they can do to facilitate their own care. And one of the things they can do is contribute to medication reconciliation by having a list and by knowing that wherever I am, if I change to another healthcare providing situation, I should have a medication reconciliation done between where I was and where I am now. I think if patients will understand the importance of that list and the importance of their role in making sure the list is with them, where it is, how it gets conveyed, I think the message is there.